4 warning signs of a silent heart attack that are easy to overlook. Not every heart condition has obvious warning signs. There is not usually an alarming chest clutch followed by falling to the floor as shown in movies. Some heart symptoms may not appear in your chest, and it can be difficult to determine what is going on. If you've ever seen a movie where an actor had a heart attack, you've undoubtedly seen them clutch their chest, eyes rolling back, and crying in pain before collapsing to the floor. However, a Hollywood heart attack might differ from a genuine one. The pain that you feel during a heart attack may be far less dramatic or even non-existent. If you're experiencing a heart attack, you already know to dial 911 immediately. However, if you do not have the obvious indicator of abrupt chest discomfort, which everyone is taught to recognize, it might be confusing. This is known as a silent heart attack. It means you are unaware that you are having one. However, it is still harmful and perhaps life-threatening. According to the American Heart Association's 2022 figures, these so-called silent heart attacks account for around 20% of total heart attacks. Some analysts believe the ratio is significantly higher, closer to 50%. What is a silent heart attack? A heart attack happens when the arteries that transport blood to the heart become clogged, depriving the heart muscle of oxygen and nutrients. This obstruction is the cause of any discomfort or pressure experienced by a person undergoing a heart attack. The similar thing happens during a silent heart attack. Clogged arteries prevent oxygen-rich blood from entering the heart. The only difference is that the issue remains unnoticed. It's not that there were no symptoms. It's likely that the patient failed to recognize them as cardiac problems and was unconcerned. Risk factors for silent heart attack. According to research, there are 3 key factors that independently increase the risk of a silent heart attack. 1. Male sex. Men are approximately 1.7 times more likely than women to experience a silent heart attack. 2. Type 2 diabetes. Type 2 diabetes increases the risk of a silent heart attack by more than 8 times that of non-diabetics. 3. End-stage renal disease. People on dialysis for severe chronic kidney disease are not only at high risk of having a heart attack, but they are also more prone to have a silent one. 4 main signs of a silent heart attack. How do you know you're experiencing a silent heart attack if you don't have any symptoms? In many situations, a silent heart attack produces symptoms, although they are not as strong or acute as those of a traditional heart attack. As a result, they are less easily recognized. Knowing these 4 indicators of a silent heart attack might one day save your life. 1. Chest pain, fullness, pressure, or discomfort. A heart attack can cause sudden and extreme pain, making it easier to spot and seek medical attention. But what if it isn't? Most heart attacks cause just minor pain or discomfort in the middle of the chest. You may also experience pressure, squeezing, or fullness. These symptoms often appear gradually and may fade and return. This can be complicated since the symptoms could be due to something less serious, such as heartburn. However, you are the most familiar with your own body. If you suspect something is wrong, you should consult a doctor or visit the emergency room. 2. Discomfort in other areas of the body. A heart attack does not simply damage your heart. You might feel the symptoms all over your body. However, this might complicate the diagnosis of a heart attack. You might feel pain or discomfort in your arms, one or both, back, neck, jaw, or stomach. These symptoms may differ from person to person. For example, some people describe their back pain after a heart attack as feeling if a rope had been wrapped around them. You may also experience intense pressure on your back. In any case, if you suspect you're having a heart attack, don't ignore any of these less evident symptoms. 3. Flu-like symptoms. Silent heart attack symptoms might be similar to the flu: nausea, vomiting, or a cold sweat. Waking up with a cold sweat, feeling nauseated, and vomiting, typical flu symptoms, but they can also be signs of a silent heart attack. You may know how the flu feels because you've had one before, but if your intuition tells you that these flu-like symptoms are something more serious, pay attention. Don't dismiss these symptoms as the flu, stress, or simply feeling under the weather. they might be far more serious. 4. Dizziness and difficulty breathing. If you feel as if you've just completed a marathon but just walked up the stairs, it might be an indication that your heart is unable to pump blood to the rest of your body. Shortness of breath can occur with or without chest discomfort and is a typical indication of a silent heart attack. You may also feel dizzy or lightheaded, with the possibility of fainting. Though this can happen to both men and women, women are more likely to develop shortness of breath. If you're experiencing challenges with things that weren't previously difficult, like making the bed or walking the dog, make sure you get it checked out since it might be a subtle sign of a heart attack. Complications. In certain situations, a silent heart attack can do minor damage, or the heart will be able to revascularize itself, essentially performing its own bypass. But this does not imply that a silent heart attack is any less severe than a typical one. A silent heart attack, like any other heart attack, can cause irreversible damage to the heart, resulting in short and long-term consequences such as 1. Heart failure. Heart failure is the inability of the heart to pump enough blood to meet the body's demands. A 2018 study discovered that a silent heart attack raises the chance of heart failure by 35%, regardless of severity. 2. Ischemic stroke. This form of stroke is caused by a blockage in blood flow to the brain. A 2021 research published in the journal Neurology found that having a silent stroke raises the chance of an ischemic stroke by 51%. 3. Sudden cardiac arrest. This is the moment when the heart suddenly stops, resulting in death. A 2019 research of 3,299 persons who died of sudden cardiac death with no prior history of heart disease discovered that 42% showed heart damage compatible with a silent heart attack. Causes of silent heart attacks. A silent heart attack, like any other, has the same underlying cause. It generally happens when plaque builds up in a coronary artery and ruptures spontaneously. The rupture causes a blood clot to develop blocking the artery. Unless the obstruction is removed, that portion of the heart muscle will die. When this happens, around 1 out of every 8 cases will be asymptomatic, without symptoms, or subclinical without noticeable symptoms. There are various reasons why this may occur. 1. Symptoms differ by sex. Women who suffer a heart attack are more likely than men to experience unusual symptoms such as exhaustion, nausea, vomiting, and shortness of breath, but no significant chest, arm, or jaw pain. 2. Differences in pain thresholds. Some folks just have greater pain tolerances and may not see their symptoms as worrisome. A 2016 study discovered a relationship between undetected heart attacks and increased pain thresholds in women. 3. Effects of chronic disease. Certain conditions, particularly diabetes and chronic renal disease, can destroy neurons that transmit pain signals, thereby muting angina feelings. Well, there you have it. Hope it was useful. Thanks for watching.